So I'd like to call the meeting of the Brockton Board of Health for December 3rd, 2020 to order. At the meeting today is myself, Dr. Andre, Mr. Fisk of the Board of Health, and Dr. Mondesor, our executive officers. So on the first item on the agenda is the minutes from the November board meeting. Any edits or a motion to approve, or any edits that need to be made to the minutes?
Motion to approve.
Second.
All in favor? Aye.
Aye.
Okay. Second item on the agenda is the memorandum of understanding with the Massachusetts Health Officers Association and the City of Brockton Board of Health for the tobacco control and sale for the city. So the memorandum of understanding has been executed, Dr. Mondesor, and
yes,
okay.
Dr. Coffey, the day after the meeting in November, we send the signed copy to the other partner, and we receive a copy. So the plan has been executed.
Okay, and have they been in touch with you at all since that time to start planning for the program or for the city?
Yes, they have. The person who is going to be supervising it has gotten in touch with me, and so we have a meeting scheduled for next week.
Wonderful. Anyone else from the board have any questions concerning this?
Well, that's pretty straightforward.
Great.
None here.
Okay, excellent. So let's move on to the next item, holiday celebrations. We've gotten past Thanksgiving here, and unfortunately seeing numbers that were expected of cases rising at this point. Christmas coming up. You know, I think our last recommendations around the holidays were to follow those of the CDC, and those recommendations about limiting traveling and limiting the groups that you gather with to those that you are basically in your household or are already in close contact with. I don't think there'd be any other changes to those recommendations. Craig, I don't know if you have any other comments on this or anything.
No, they've been fairly consistent for the most part, and given the status of our city and the state, there's no reason to make any change in that regard.
Right. So, and Dr. Mondesor, any plan changes in the city or issues that you want to bring to our attention regarding any celebrations or any issues around the holidays that have been brought to your attention?
Well, presently, I know the mayor is contemplating to pass some more ordinances to give how people should celebrate. So basically, I think moving forward, starting next week, there might be some information coming from City Hall, along with the Board of Health.
Okay, great. Okay, so we'll move on to the next item then, if there's no other discussion.
Well, can I just ask, so does that mean that there's a chance that we might deviate from what the state and the CDC is saying?
I don't know how the mayor wants to move, but he wants to be a little bit more comprehensive in the city, and perhaps a little bit beyond what the state is doing, because it seems that the governor is yet to give a definitive plan what to do, how to do it. And so therefore, that is why I'm not able to say at this time how we will move, but we're working along with the mayor to know specifically what guidelines we will provide moving closer to the end of the year.
Yeah, my main concern is that we don't go we're not any less restrictive. We should be as conservative as we can be.
Yes, we're not.
Is that your sense, Mary?
That's my sense, yes. I mean, the minimum is the guidelines coming from the CDC and from the state, absolutely.
Yeah.
I mean, if the mayor feels that there needs to be more restrictions or there are particular issues that he needs more restrictions on, or if he needs any advice from the board, happy to help in any way. But I agree that, you know, as long as we definitely need to follow at least the minimum guidelines that are being sent, what I would consider, and everyone should consider, the minimum guidelines that are coming from the from the CDC and from the state. So.
With the only caveat that we recognizing that, you know, the capacity for some in our city, given housing stock and families living in kind of small apartments and all that, we have to be as mindful about that as well, as we've continued to say through this time.
Right. Right. Any further discussion on this issue?
Nope.
Okay. Next item is the flu vaccine clinic. So I see that you've held a number of clinics as of this point. Are there any further clinics planned, or?
Right now, there's a possibility for just one for a daycare center that we have worked with in the past. So they have yet to give us a time when they can a date when they can schedule.
All right. Great. And there've been no issues with the flu clinics. They've gone smoothly for you, and your staff you've been adequately staffed to meet the needs?
Well, yes. Well, if I could jump ahead, in Roman numeral 9 on the agenda, we are fully, I mean, the nursing department is up to par now. We have added 2 more nurses, one last Tuesday. That was the last Tuesday of November, and then Tuesday, December 1st, the third one came in. So right now we have 3 nurses.
That's great to hear.
In-house.
That's really good news.
Yes,
yeah.
Thank you. Yeah. Thank you for your efforts.
Oh. All right, so let's, and if no other issues about the flu clinics, and any other issues regarding the nurses, so that the 3 are on board, you've got them up to speed and are getting them up to speed in the office, and will be, you know, dividing the work as need be among the nursing staff that you have.
Yes, okay. Right now, one top priority of ours is contact tracing for COVID. Yeah. And in order for them to do it deliberately or on their own, they have to be approved by, certified by Maven, which is the, as you know, the ambassador. Mm-hmm. Yeah. Okay. And so the one that started last week was able to do the webinar, which is a 3-hour, and then took the test because there is a proficiency test. And then to wait maybe another 5 days or so to get qualified. And then once that person is qualified, there will be a password to access Maven. The other one that started on Tuesday, this just a couple of days ago, has to wait until Monday because they give the webinar every Monday. And then once that person goes through the training, then she would be able to also take the test. So that would allow all 3 of them to be able to help in contact tracing, which is really critical for us. Right.
Yeah, and I'm sure Evelyn is very grateful to have some help in doing that because she's done a phenomenal job of being the only nurse on the board up until now. So I'm sure it's a relief, and particularly at this time, to have another couple of nurses on board. So.
For my own interest, you know, was there any concern with residency for the nurses?
Yes, but so far I think both of them, there is one, actually both of them are residents of Brockton, both of them. Yeah, because one has lived here, has gone to high school here, and has worked at Brockton Hospital. The second one, also resident of Brockton, so they have met the requirements.
Oh, great. I just wanted to be sure there's no concern there. Okay,
cool. Wonderful, great. All right, so next item on the agenda is the dashboard for COVID, which I've, you know, it's a great dashboard. It's very nice to have. I see that, however, that we're now in the red zone with a positive rate over 7
Yeah.
within the city, and sort of a rising numbers here, with even with hospitalizations, et cetera. So, you know, it's concerning. I'm not aware of how we're approaching sort of hospital capacity within the city. Do you have any idea of where we stand at this point with capacity within the city?
At this point, I think tomorrow we have a meeting with them. If we have 2 meetings a week, so we'll have the latest. But so far they have moved to close to capacity, both Brockton Hospital and Good Sam. So at least I know Brockton Hospital has moved to close visiting hours. They're not
Right.
accepting that so far.
Right. Okay. Yeah. I think a lot of the hospitals in town are starting. Well, many of them, I'm not sure. It's probably a question. I know a lot of the hospitals cut back the COVID capacity. You know, the specialized units that we had that were open were sort of cut back during the summer. You know, and you can alter it and extend that capacity. So I'm not sure, you know, if the city has that, or the other hospitals have done that or are considering that. But certainly, it's happening, beginning to happen now in town, that we're expanding capacity. So
they're starting to kind of change the kind of voluntary, discretionary procedures and everything like that to make sure that they have the capacity they need.
yeah. So. Have there been any issues with any? I know our surrounding towns too have had issues with the schools in the city of Brockton. We were not on the list of those that have had sort of the recent cluster outbreaks, but have things been okay? Do you know, Dr. Montessor, the schools here in the city are doing? How the schools are doing?
Yeah, we continue remote, and with Linda, Dr. Cahill, they're reporting for any case among the school population, children or relatives, but given that they're working remote, so it's not a major factor for students, but they had somebody who was positive and in a meeting at the Brockton High School facility. And after that, they have put things remote instead of having in-person meeting. That was the committee, the school committee.
Right. Okay. Yeah, they should limit meetings. Absolutely limit meetings. Are the teachers remote as well, or are they using the classroom facilities for?
I think some of them check in, but without student present.
Yeah. Okay. All right. And there's been no issues in far as the staff within the schools themselves.
As far as I understand, yes.
Great. Wonderful. All right. Great. Any questions on COVID within the city from any of George or Mr. Fisk or Dr. Andre?
Yeah, I've got one question in regard to distribution. Everything you see now, it seems like we're getting very close to, the 3 different vaccine companies as far as distribution. I don't see anything about that. I mean, it looks like it's coming pretty quick. So I was wondering how we're working on that.
As far as I understand, this is not going to be a direct municipal kind of decisions. There'll be some they're going first with the healthcare providers. My understanding is, and they had been considering nursing home staff and residents, but I think there's still a kind of fluidity on where the committee with the CDC is going to kind of land on what the first priority wave of access is, and then they'll be following opportunities. And each state is really kind of trying to manage that considering some still challenges from a federal standpoint. So there's still a lot of unknown right now. And I think it'll start from, there'll be an element of it coming from the Department of Public Health and their command center, and considering how they have an equitable distribution across the state.
Well, thank you, Dr. Greg, Dr. Andrade, for taking on that also. I left the item out. I put it under miscellaneous, not naming it specifically, until I had a chance to speak with Dr. Brophy, because the Department of Health has reached out to us, offering us the opportunity to sign on. And so there is a form I need to share with Dr. Brophy, and then we return it back to them. That will put us on the list to be for eligibility. Sorry.
Yeah, so definitely we'll be in contact, and I'll get the form back to you signed to be on the list for the city. You know, there are going to be a lot of challenges with this vaccine, and I think even when we had back in when H1N1 and talks of a swine flu pandemic, the plans had been one for sort of a distribution throughout the city, but it involves sort of, using areas like that. I think the logistical challenge with this one that I think we're all dealing with is at least for the what will probably be the two candidates that will get approval immediately is the logistics of the storage, which is going to make distribution much more difficult to navigate. And I think the hospitals and medical centers probably within their staff will be able to. Most of them will be able to obtain the freezers, et cetera, but how you're going to do this in a broad way across a city once the population starts to be vaccinated is going to be a logistical challenge, and one that once it is approved, and I think the first line folks that will be getting it will be in localized, like healthcare workers, et cetera. There'll be a system for that, but I think the more wide distribution of the vaccine for the city, if we're going to be distributing it, we really do need to, and we'll sign on and take the guidance from the state and hopefully some support. England is starting the vaccine, and hopefully we'll learn something about the logistics of trying to do this, but there are some logistical challenges that are above and beyond what we thought of in the past for vaccinations because of the cold storage that's needed for both of these first two vaccines, with the other ones not expected probably for trials. And Craig, I'm hearing sort of, it's going to be more in the spring that the next set of trials will probably come through and be ready for FDA approval. Would be, they'll be lagging behind the Pfizer and Moderna cold ones that both require the cold storage. So. Yeah,
I'm hearing the same thing. Late spring, early summer.
Yeah. So. And like I said, there will be challenges with the, those probably will be not some of, I believe some of the other ones, at least the three others that are in the pipeline don't require this cold storage. So we'll just have to, right now deal with the issue of the priority and getting it into the various health care systems. But once it gets to the point that the city, if we have to distribute to the population in the city, we're going to have to, there's going to have to be a lot of thought and planning done if we're still using the, and probably will be using some of the Pfizer and Moderna vaccines moving forward because of the temperature requirements that are needed. So I'll be in touch with you, make arrangements for the document to be signed, and we'll await, as everyone is awaiting, really the distribution plans to be put in place. I think the meetings are next week, actually, for at least the Pfizer, and hopefully the emergency approval will be given, and vaccinations are planned. I know at our medical center, we are already ready with the cold storage ready to go to start vaccines as soon as we get them on site. So, and hopefully several other medical centers and medical facilities to at least start with the first tier of folks that will be getting the vaccine. So, okay. All right. So let's move on then. If there's no other discussion on this, okay.
Nope.
Go ahead, Craig.
No, I had none.
Okay. All right. Planning, so the next item is planning to recruit and hire ambassadors. So I see that you have 3 applicants as of now that have applied and that you're in the process of interviewing. Is the posting still out there are you still trying to hire other individuals or?
Yes, we are. Basically, we were planning to start with at least 8 individuals, but the process has been very slow and not that many, we didn't receive that many applicants. So there were about 5 as of this morning. 2 were supposed to be interviewed today, but somehow it seemed that one of them has declined. So we had 1 interview today, and most likely we will have 2 tomorrow. And I think of the 5, 1 of them has tested positive for COVID. So unfortunately, so by tomorrow, probably we'll have 3 prospective candidates moving forward. And then the application process the posting will remain open probably for some more time.
And has the posting been distributed to places like to the colleges and people where maybe folks are training in health that may be interested in the jobs?
I am not sure because I left that to HR and they were using all the channels that they had.
Okay.
So I don't know. I would have to double check to see where else we could post it because the visibility, somehow, I think one problem is visibility and then maybe the level of interest in that particular job.
Okay. Okay. Any other questions from any other members of the board?
None for me.
Okay.
No.
George, okay. Okay.
All set.
We've already done the updates on the nurses, which is the next item on the agenda. And then miscellaneous, I was going to bring up only in the miscellaneous about the preparing for the vaccinations for the COVID vaccinations for the city, or at least the plans thereof. Is there any other items that anyone on the board would like to bring up?
None for me.
I'm all set right now.
Okay, great. All right,
Is
then.
this something, do you see anything I have one question.
Sure.
One question
Sure, George, go ahead.
about vaccines. We're not looking for anything this month then in the city.
There won't be anything available for a
December.
while.
No,
No.
No.
for a while. Okay.
Yeah, so the approval
That's-
would be expected, at least the first approval, I believe the meeting is next week on December, I believe it's the 10th, for the Pfizer vaccine. So the emergency approval by the FDA the meeting is taking place that day. It has to be approved, then I believe there's some stocks around in places, I'm not sure where, if the state has, I assume the state has some already, but then distribution to the, has to occur to the areas where the vaccines are going to be first deployed. Vaccinations are going to first be deployed within the state. And my understanding is it's like there will be probably about 20 million people that across the country are numbers that I'm hearing. That they'll have enough vaccination for during these initial phases, which will be beginning probably in January, that the vaccinations begin. And then from there, it'll be, whatever I think even the CDC has only come down with, or the recommendations from, I believe it was the CDC, on the first tier being, the healthcare, for healthcare workers and for the inpatient populations, nursing home populations, et cetera, was their first recommendations. And how that's implemented at the state level, we'll be awaiting the state guidance for that, is my understanding. Is that, Craig, is that what you've been hearing as well?
Yeah, that's what I've been hearing, and yeah, it is an advisory board within the CDC that's managing it, of experts. And again, all accounts I hear is that the general populace really won't likely get access to it until
Spring.
maybe starting late February, March into June. And that's a kind of a loose guesstimate. There's still, it's quite likely that there'll still be some challenges that we can't anticipate now that is going to cause a delay. Most people are suggesting that the general public shouldn't expect to see it until springtime.
Yeah, I've been hearing.
I hope that's wrong. Yeah.
I hope it is too. And like I said, I think the the challenge in the general population is going to be how you can, particularly since the third and fourth vaccines probably will just be coming out of trial then, with data available for evaluation by the FDA, is that it's going to be difficult. You can't just open up or have it at your local CVS. Because of the storage requirements. So there's going to be very focal areas where probably where these vaccines can be stored and given in the time frame. Particularly the Pfizer one, the Moderna one appears to be more, it can be kept at refrigerated temperature longer, it sounds like, than the Pfizer vaccine can be. But there's only a small period of time that it can come out of that, the minus 80 or below storage that's required for them to be in. I believe it can only be in those like minus 20 for a very limited period of time, and at refrigerated temperatures for a very short period, and has to be given once reconstituted within a few hours of reconstitution of the vaccine. So there are going to be some more challenges in trying to figure out how we can do this in a large scale. So
I think that's a very good explanation of it, because I think that's one of my leading questions I get outside when people ask me questions about the vaccine. When is it coming? And it's nothing that's going to be under the Christmas tree this year. So so that's what people want to know, and I think that's the biggest thing people want to know. And I think you explained it, they get a good idea of the, how complicated it is. So
yeah. And as I said, England is beginning this ahead of us. So, and they're, it's a different healthcare system, though they do have a nationalized healthcare system. So it's easy to sort of coordinate easier to coordinate across that system. But still, I mean, how I'm sure, just as COVID broke out within in March, the changes in the way we practice and some of the techniques and some of the innovative ways people have figured out how to do things when the supplies were short. People will come up with ways and hopefully some techniques that'll make this less challenging as we move forward. We'll see. It happened. The changes that happened in the medical centers happened incredibly rapidly, and people figured it out, how to print their own, use the 3D printers to print swabs and mix their own hand disinfectants in their pharmacies, etc. Are the types of things that people were able to do, and build the equipment that they needed locally to make things work. So hopefully, we'll figure this out, and not everybody's thinking about it and working on it. It's amazing what can happen when everyone starts rowing in the same direction to solve a problem. So, and this has been an amazingly rapid development of a vaccine, and an amazingly effective vaccine with a new technique that's promising not just not just with COVID, but for other types of vaccinations, techniques that can be used for other things in the future. So
I'd only add, in my experience, I've been surprisingly impressed by how consistent the general media has been in terms of kind of relaying the same messages that we've just talked about. There hasn't been a big rumor mill that's going all in different directions. They've been generally able to find ways to kind of deliver the same message to most. And most of the media outlets I've watched have said, yeah, spring is likely the most reasonable expectation.
Yeah, and Dr. Martis, I think the most important thing, from your end right now, how can you prepare for this moving forward, is really to stress throughout the city and to all the populations in the city that the vaccinations are critical in controlling this virus. And not to be afraid. There's a lot of anti-vaxxers out there, or people that fear the vaccine. Having seeing what patients go through, it's not just the mortality of COVID. It's the morbidity of the COVID infection in many patients. That they, even if you survive, you walk out of the hospital with respiratory damage, or with renal damage, or with having an MI or a stroke. There is morbidity around this virus as well, and it's important that people understand the risks of the virus is not just the death from the virus, but there are other things to worry about that we see people who are caring for those patients see, and I'd say in the healthcare community, having the unpredictability of patients having bad outcomes. We've seen many younger, not even patients not high risk, that have had very bad outcomes from this. It's important to recognize that in many patients, yes, it's asymptomatic, but in many others it is not, and it is hard at this point to know in any individual what their outcome would be, and we hope everyone that has COVID right now, and the monitoring, and we have better management of the disease clearly than we did back in March and April. But really, this is a virus that causes both death and morbidity, and it's important to be vaccinated. And that the vaccinations, nothing was done in a way that the safety of this vaccine was overlooked. Nothing has been rushed with that, and it appears to be, by what's been said, and we'll see what the FDA has to say in its emergency approval, seems to be incredibly effective, and right now with safety profiles that have looked, at least what have been coming out publicly, look very good and very similar to what we see in the usual vaccination issues. So I think, as you get your ambassadors on board and folks, I think it's important that, throughout the city that people are made aware that vaccination, when we get it and get it available, we will be vaccinating, and that we want people to come forward to be vaccinated. There will be a priority for those at the highest risk, probably. I know that that's the way it's going to come down, that the highest risk will be done first, but that it's important that everyone be vaccinated. And even after vaccination, we're going to continue to wear our masks and et cetera, because we have to be able to assume, as we all do right now in the healthcare system, is that everyone is infected and that you are infected, and every patient you see you put at risk, and every patient that comes in has to be protected. So we're gonna. The vaccination doesn't mean we take the mask off until we get to a point where the viral load within the population and the herd immunity, the immunity of the population is at a level that allows us to do it. So it's still going to be a haul, but hopefully a much safer haul as we all get vaccinated. So over time. So we'll have to work on have your ambassadors and folks working on making sure that that message gets put out there, so that when we do get this vaccine and we can start it, that people will step forward and get the vaccination. So, anyone else have anything to add, Craig or Mr. Fisk?
No, you've said it well. And it is going to be a new experience compared to other vaccinations. So all of us will learn as we go, and we'll I'm sure get really good guidance. There's even a director now that is working within the incoming administration to be sure that all that information is readily available for people like us to be able to kind of help support the community as they make these decisions and try to encourage them to get their vaccine so that their family are safe and the community is as well.
Yeah. Great. So with that, if there's no other items, I'd entertain a motion to adjourn.
Seconded.
Make a motion that we second.
Okay. All in favor? Aye.
Aye.
The meeting of the Board of Health is complete. Our next meeting will be, I believe, January 7th will be the next meeting of the board. All right. Everyone stay safe. Have a great Christmas, a holiday, and the holiday times for everyone. And we'll meet again in January.
Merry Christmas.
Thank
All
you.
right.
New Year.
Thank you so much.
Happy New Year. Take care. Bye-bye.